Hi guys, my name is Mark-Angelo from the College of Nursing, and today I'm going to discuss all about the electrocardiogram. So, what are we waiting for? Let's go! For the purposes, there are two purposes. Number one is to measure the heart's electrical activity, and second one is to diagnose other diseases. In the assessment, there are 5 things that we need to consider in assessing the patient. Here are the following. Next one is planning. Before doing the procedure, here are the materials that we need to prepare and gather. Next one is the procedure. Step 1, we must check and verify the doctor's order. Second one is identify the patient with 2 identifiers and explain the procedure. Hi ma'am, my name is Mark-Angelo from the College of Nursing. May I know your name and your birthday? Ma'am, we're going to do ECG po. So yung purpose po ng ECG is to measure po yung heart's electrical activity and then also to diagnose other diseases. Next one is do hand washing and put PPE indicated. Then, close curtains around bed and close the door to the room to provide privacy to the patient. Then, have the patient lie supine in the center of the bed with the arms at the sides. Raise the head of the bed if necessary to promote comfort and expose the patient's arms and legs and drape appropriately. Encourage the patient to relax the arms and legs. Note that we must select flat, fleshy areas in which to place the electrodes. Avoid muscular and bony areas, and if the patient has an amputated limb, choose side on the stump. Also, if an area is excessively hairy, clip the hair. Do not shave hair. Clean excess oil or other substances from the skin with soap and water and dry it completely. Then, apply the limb lead electrodes. The tip of each lead wire is lettered and color-coded for easy identification. The white or RA lead goes to the right arm, the green or RL lead to the right leg, the red or LL lead to the left leg, and the black or LA lead to the left arm. Next one is connect the limb lead wires to the electrodes. Make sure the metal parts of the electrodes are clean and bright. Then, expose the patient's chest and apply the precordial lead electrodes. Then, position chest electrodes as follows. B1, fourth intercostal space, right margin of the sternum. B2, fourth intercostal space along the left margin of the sternum. B4, fifth intercostal space, mid-clavicular line. B3, midway between B2 and B4. There. B5 is fifth intercostal space, anterior axillary line, same level as B4, and B6 is fifth intercostal space, mid-axillary line, and same level as B4. After the application of all the leads, make sure the paper speed selector is set to the standard 25mm second and that the machine is set to full voltage. Then, ask the patient to relax and breathe normally and instruct the patient to lie still and not to talk while you record the ECG. Then, press the auto print button. Observe the tracing quality and the machine will record all 12 leads automatically. Next is we must encourage diaphragmatic breathing throughout postural drainage. This helps widen airways so secretion can be drained, suction if needed. Once the machine finishes recording the 12-lead ECG, remove the electrodes and clean the patient's skin. After disconnecting the lead wires from the electrodes, dispose the electrodes. Clean ECG machine per facility policy, then remove additional PPE if used and perform hand hygiene. Then, lastly, we must document the procedure and other observation.